Hi everyone, my name is Jessica, and this is a video presentation about ethical considerations in interprofessional collaboration by Brianna, Lorenza, Minnie, and myself. This presentation will cover the topics of defining interprofessional collaboration and how healthcare providers ensure its ethical use in their everyday practice. We will also discuss common ethical issues in interprofessional collaboration, along with effective resolutions to these issues. Interprofessional collaboration is the interaction of two or more professionals. The professionals may be from the same or different disciplines, but they will have a common goal to solve or are exploring common issues, seeking the best possible outcome for the patient. Ethical interprofessional collaboration promotes the well-being of the patient. It is an interprofessional process of communication and decision-making where individuals are able to share knowledge and skills to influence the patient care provided. Collaboration of care honors that diversity that is reflected in the individual expertise that each profession may bring to a team dynamic when arranging the delivery of care. There are many important principles that aid in ensuring that interprofessional collaboration takes place. Professional autonomy should be respected. This means that as professionals, we must respect each other's roles and have trust that we each can do the part we are responsible for in this team. That means as providers, we must respect and to some extent negotiate the professional autonomy of medical assistants, pharmacists, RNs, administrators, and all other members of the healthcare team. Without this respect, collaboration will wither away due to team members feeling undervalued. It is important to remind ourselves on a daily basis that each healthcare professional has been trained in their role with the patient as the center of focus. This means that there may need to be some role clarification, and this truly needs to begin back in school as these soon-to-be professionals are learning how to navigate this healthcare world. This brings us to the second key concept being beneficence. This means that all healthcare professionals must act with the benefit of the patient at the forefront. This includes shared decision making on the part of the provider and patient and/or family so that care is not taken as paternalistic or condescending. Shared decision making is also important with interprofessional collaboration because as a healthcare team, we must all work together to make decisions. For example, the provider, physical therapist, nurse, and case manager all work together to decide on a patient's discharge plan. It is important to respect each team member's assessment and professional opinion on how to move forward to decide together on the ultimate plan, taking the patient's desires into consideration as well. It would not be successful or beneficial for only one member of the team to make all the decisions without the assessment of the physical therapist about mobility, the RN about medication safety in the home, the case manager on community resources needed, and the provider on the patient's medical requirements. It is vital for healthcare facilities to have institutional policies and procedures in place. If these are not in place, there is room for healthcare professionals to go out of bounds, so to speak, and interact in a way that could be detrimental to interprofessional collaboration. For example, if there is not a clear policy in place on how an MA should handle a certain patient care situation, the MA does not conduct themselves in the way the provider personally believes they should have. And then the MA gets reprimanded for something that did not have a clear policy. This can be confusing, can cause resentment between the MA and the provider, leading to disengagement and conflict. If clear policies and procedures are set in place, this gives both parties involved clear understanding of their role and an example to follow. This also gives course for discipline if a procedure or policy is not followed. Effective communication is key for interprofessional collaboration to work. It is vital to have open lines of communication between professions and that professionals feel comfortable communicating with each other. In the example of the MA, after they were reprimanded, they may have felt afraid to communicate with the provider after that. This shuts down all ability to effectively collaborate. Communication also allows professionals in different roles to understand what is going on with a patient or situation without having to assume anything. Communication is also important in preventing errors and keeping our patients safe. As a healthcare professional, we must each fully commit to interprofessional collaboration. This commitment needs to take place daily. Sometimes it may be uncomfortable or hard, but it is vital to success in providing the best quality care to our patients. With committing to this, it is important to stay informed. This means that education must be provided to all members of the team on how to be an effective interdisciplinary team. This includes clarification of roles. It means that all members of the team need to be familiar with chain of command and with the policies and procedures that are in place. Many ethical issues may arise during the implementation of interprofessional collaboration. Some examples of this are mistrust in other professions, such as a physician not trusting a nurse's physical assessment findings. Stereotyping can also create ethical issues and communication barriers between professions. For example, a physician may be reluctant to take the pharmacist's advice because they may be seen as just pill counters. Or a nurse may not value the input from a nursing assistant because they might lack formal education. Lack of respect for professional autonomy can also create issues. If there is lack of respect between the members collaborating, poor communication and outcomes may be produced. Condescending language or talking down to another person can create huge barriers in effective collaboration. This problem can also be achieved unintentionally by the speaker if they are not careful and sensitive when choosing the words to convey their message, as some remarks may be interpreted by the listener as being condescending or devaluing. Devaluing another professional's opinion or input can also be done non-verbally, by exhibiting devaluing actions like rolling one's eyes when a new idea is presented, or by failing to listen to another professional's opinion. Uncommitted members can destroy team collaboration, which can result in moral distress, disempowerment, and anger. Different perspectives about patient outcomes, power struggles among team members, lack of role clarity, lack of understanding about the roles and scopes of practice of other providers can create misunderstanding and huge ethical issues. Another issue in implementing and sustaining interprofessional collaboration is by legitimizing hierarchical relations and physician override to the collaborative findings that are produced when interprofessional communication takes place and new ideas are shared. Institutional policies and procedures may not adequately support interprofessional collaboration in decision making. Many organizations may not have strict policies for physicians, and therefore they may not support interprofessional collaboration and instead independently make decisions on their own without the use of a multidisciplinary team.
Please hang up and try again.
Interprofessional collaboration works best when professionals acknowledge the capacity of the individual who has the most knowledge and experience when it comes to make certain patient care decisions. Each professional comes with a wealth of education when it comes to their particular specialty. Having common virtues is key in resolving ethical issues. Common principles are also important. However, mutual respect and trust are the foundation to effective interprofessional relationships. If there is no mutual respect between team members, Timely, accurate information will not be heard or acknowledged. It has now become part of many program curriculums to teach interprofessional competencies related to values and ethics, in hopes that this will close the loop and bolster effective interprofessional relationships and collaboration.